What's good, guys? Welcome back to my YouTube channel. Welcome if you're new here. It's a Friday and I am knocking off Ichaile. So I thought I should quickly sit down for a minute and film the video. Today I want to talk about things that I wish could happen in the South African nursing fraternity. So people look at us and they admire us, right? They are nurses, they are living my dream and stuff like that. And this video is not to say to anyone don't study nursing or don't become a nurse, but I actually want to show you that nursing also has struggles just like other professions, if not worse. Whatever. But yeah, so I wanted to actually talk about things that I wish were different in the South African nursing industry. But before we do that, before we get onto this video, let's simply hit the subscribe button and be part of the Nessie channel. If you are viewing my videos for the first time, thank you so much to my subscribers. I think yesterday, which was on Thursday, I literally got like 22 subscribers, so we are doing well. Let's rally on and hit a 1,000 subscribers before the end of this month. Yeah, let's get on to this. I'm gonna talk about 3 things that I wish could change in the nursing fraternity, or that I wish could happen in the nursing fraternity in South Africa. Number 1, I wish that as nurses we can actually have a good relationship with our patients. And also our patients to have a good relationship with us. So I think that the nurse-patient relationship in South Africa is really not in a good state. According to my own judgment, I'm literally emphasizing that. I think we're currently sitting at 4 out of 10. I wish our patients could love us more, respect us more, and I wish we could care for our patients more and love them more. I wish we could understand each other, and patients not to come into the facility with that mentality of saying nurses are rude, nurses are mean. And also I wish nurses could have an attitude that has all the things that we've been taught in school: to be compassionate, to be caring, to be a good listener, and to also advocate for our patients. One thing that I think it's making our patient-nurse relationship not to be good in South Africa, I think it's the difficulties, which I'm gonna get into, but the difficulties that nurses get to find themselves in terms of their working environment, in terms of the employer, and also the difficulties that patients get to find themselves in terms of their environment, like their family members at home, the background and all that. So I think that also affects the nurse-patient relationship, and it actually makes it to drop. I wish nurses and patients could have a very good relationship. Trust me, there are other patients that you find yourself having a very good relationship with. One thing that patients need to understand is that clinics or hospitals, they are run according to protocols, according to regulations, and all these other laws that have been implemented by the National Department of Health. And unfortunately, the people who are supposed to implement those rules and regulations are nurses. So sometimes when you try to implement what is written on the policy, the patient will feel like you're being against them. So sometimes patients don't understand that you actually have responsibilities as a patient. You will get a patient that knows that they have rights, but they don't know their responsibilities. I'll make a simple example. A patient will want to not come to the clinic when they are supposed to come to the clinic. Let me say you're gonna give them an appointment and they'll decide but they're not gonna come on that appointment, and they're gonna come whenever they. And it's not something that is acceptable. We have been given rules from the department. I'm supposed to be using an appointment system. So as a patient, you also need to be responsible that you honor your appointment. You know, when you are given an appointment at the clinic, honor it. And if you can't, if you won't be available on that day, go to the clinic, actually reschedule the appointment. The second thing that I would like to see changing in South Africa in terms of nursing, it's definitely our salaries, guys. No. Guys, as nurses, we cannot continue earning what we are earning in South Africa. I'm sorry, it's wrong. Like, it's okay. I don't think that the government pays nurses enough. I'm not even going to sit here and lie. We are not being paid enough in South Africa. And I also think in Africa, in fact, nurses are not being appreciated by the employer. Okay, I'm not going to talk on private sector because I've never worked for the private sector. But to be honest, Ines as holy betunana. Like you have to wait something like 10 years, 20 years for you to earn something that looks like a good salary. I mean, that time you are near the grave. So you won't even be able to enjoy that money. In fact, you've been making debts all these years because you've been living on peanuts. It's heart-aching, it's sickening, it's exhausting, it's emotionally draining. A lot of nurses are not happy because of that. I know people will say nursing is a calling. Nursing is not a calling, you guys. Nursing is a profession. We go to school for 4 years. So you can't come here and tell me nursing is a calling. It's not a calling, it's a profession. I decided to study and become a professional. So we can't be told, no, it's a calling. A calling is like you get things from abapansi. So no, nursing does not come from the underground gang, you guys. It's a profession. We go to school for 4 years. So this thing of us being expected to give an arm and a leg and our entire whole life for peanuts, it's not right. It's really not right, and it definitely needs to change. And I have no idea who's going to change it because it has been like this for decades and decades. Nurses die with arthritis. Nurses die with all different types of conditions that they contract because of the type of job that they're doing. They are still earning peanuts. And I'm really hoping that with our generation, we can change the tables. We can actually make the tables to turn in terms of our salaries, and people start recognizing us and appreciating us properly. Okay, the last thing that I wish could happen in the nursing field is actually the government taking responsibility of their own actions. It's so sickening, it's so exhausting, it's so tiring to literally like watch the news every single day, and Department of Health is always on the news with money missing, with people going to court, with communities being on strike and actually trying to get rid of somebody that's eating the community's money. It's exhausting. And it's also exhausting to see how these people, they never account of the money that they are taking. But during that time, you find yourself as a nurse in a clinic and you don't have medication, you have shortage of equipment, and you are actually expected to render good quality healthcare. At that time, but they come into our consulting rooms looking for their hypertension medication, and you tell them there is no medication because the stores doesn't have medication. But there was a budget, there was money that was supposed to buy medication. It's sickening. I think that part is really sickening, and it's actually one of the things that are crippling the nurse-patient relationship, because there's no patient who wants to wake up each and every single morning, go to the clinic, and then when they get at the clinic, the medication is not there. I mean, this person, at the same time, we are also preaching about let the patient adhere to their treatment. When the patient tries to adhere, they come, there is no medication, OS from stores. Guys, it's exhausting. I really wish that the South African government can actually start taking public health, not even only public health, but public services serious, because at the end of the day, we are serving our citizens, we are serving our people. We might not be serving our direct relatives just because we can afford medical aids, but at the end of the day, the poor people are actually our people. As long as your skin is dark, as long as you're South African, as long as you are African, the poor people are your people. I wish our government could actually have conscience and do better. So whatever injustice that we might be doing to the people that we are serving, it's an injustice that we are actually doing to our own people. Okay, those are the things that I wish could actually change, and things that I think each and every single nurse wishes they could change and be better, for them to be completely happy nurses. And with the young generation of nurses that is entering this profession, I think there is light and hope at the end of the tunnel, but only if you and I, be it you are also a nurse, be it you are a patient, we actually work together and make this healthcare service rendering thing a doable thing and an enjoyable thing. Yeah, so today's video is gonna end here, you guys. I hope you did learn something and you're actually having your own points that you wish could change in terms of nursing, be it you are a patient, be it you are also a nurse. What are the things that you would like to see changing in the new South African nursing fraternity? Just drop those down below on the comment section and let's keep this conversation going. I will see you guys on my next video. Do not forget to subscribe if you're new here. Bye guys.